This is Dr. Rebekah Bernard, past president of the Collier County Medical Society, and I'm here with psychologist Dr. Steven Cohen to share information about the CCMS Physician Wellness Program. Dr. Cohen, can you give us a little background about the Physician Wellness Program?
We started the program in around 2017 because we identified physicians as a population that were dealing with a lot of depression, anxiety, stress, psychological issues in general that were not being addressed, mainly because of stigma or time and just not having availability to the services. And we wanted to be able to offer the services in a way that would support a higher level of privacy, confidentiality for physicians, because there was a lot of concern about their reputation or the impact on practicing medicine if they were seeing a psychologist.
Steve, talk about some of the main things that you see doctors coming in for to the program.
So people come in for a variety of reasons, including anxiety and depression or marital issues. But some of the main issues that I've seen with physicians specifically revolve around work-life balance. Often they have way too much emphasis on their clinical practice or their professional lives, and their family life seems to be neglected in many ways. So part of my role has been helping them find balance and spending more time for themselves, with their families, but still maintaining a level of work and quality that's sufficient to meet their requirements, depending on the environment that they're working in. This also includes improving efficiency, time management, managing conflicts more effectively. But another really common presentation revolves around marital issues. And I think it's really important to note that while the physician has to be present for these sessions, you can also use these sessions for things like marital issues, as well as get help parenting, or, if you're not sure how to handle certain issues with your children. So this isn't a session for the kids, but it can be one to help you figure out how to better help your kids or find ways to deal with certain issues. So it's really not limited to just issues around medicine or your professional life. It includes areas that involve your personal and family life. Another really big concern is malpractice or lawsuits. If there is a complaint against them or a lawsuit, that creates a huge amount of anxiety. And most attorneys will instruct them that you can't tell anyone about this. Even if they come in to therapy sessions, they often will tell me, oh, my attorney told me I can't talk about this. At which point I usually inform them that, no, this is a place where you can. This is the one environment where you're allowed to discuss these issues, which I think is extremely helpful, because they're in a situation that has this enormous fear about being sued, or if they are being sued, that they're told they can't talk to anyone and they have to keep all this in to themselves. So coming in is a good outlet for them to process their concerns, their thoughts, and kind of squash some of these catastrophic beliefs that they may be having in that moment.
Well, I certainly know that I have my share of catastrophizing beliefs, as do many of us. But it's interesting, Steve, because you seem to have a niche when it comes to working with physicians.
A lot of my training was with the psychiatry residents. So we did rounds, we went to lectures together. My training overlapped a lot more than most psychologists get. So I went into this with a better sense of what their experiences were like. And I think it's just kind of been a sense of community. Over the years and working with them, I found that I'm able to really help identify with some of the specific concerns.
Well, I've found that you have a remarkable way of drilling down to some of the unique issues that physicians face. And in fact, I have to put in a plug for the book that you and I co-wrote called Physician Wellness, the Rockstar Doctor's Guide, because it has some really practical solutions to some of the common problems that we face as physicians. And that's available on Amazon. I've had so much positive feedback from that book, and I always explain that all of the brilliance in that comes from Dr. Cohen. I was just able to channel that information into book format. But getting back
Give
to the
yourself a little more credit, but yes.
Well, getting back to the Physician Wellness Program, I do want doctors to know that the Collier County Medical Society, myself, other board members, the executive director, nobody knows who or what doctors are utilizing the program. It is completely confidential. That's something that is very important to us. However, we do get a general report or an overview of the utilization, and it seems like this program is being really widely used by doctors from across all spectrums of practice. Would you agree that that's the case?
Absolutely. From primary care specialists to hospitalists and multiple specialties, there's been a wide variety. And like you mentioned, it's completely confidential. One thing I found to be interesting is many of the physicians that have come in are extremely concerned about who else is going to know they're coming in. But once they participate in the program, they have no inhibitions about sharing their experience with others and are actually open to it. And that kind of fear of being judged or of it affecting their licensure goes away, because those are all false beliefs. And actually the majority of the physicians that come in are referred by other physicians that have participated in the program.
That is so important. That tells you everything, that doctors are benefiting from the program and they're encouraging their colleagues to utilize it. For me, it's really important to destigmatize the process of seeking help for our mental health. And in fact, I often share that I've been working with psychology for many years, and I think it's made me a better doctor and a better human being. So I encourage everyone out there, you do not have to be facing a crisis. Although if you're having one, please make that call right away. But even before you get to that point, even if you're just having day-to-day struggles, take advantage of the Physician Wellness Program.
The only other thing that I would suggest is that often I find that by the time the physicians make the call and come in, they're in crisis mode. And I'd really encourage them to use this almost as kind of a tune-up or like an annual checkup kind of thing, and come in before they're in crisis. Even if you just come in for one session, it's fine. It doesn't cost you anything. And it's a chance for you to maybe figure out what the program's about. If I really see that there's no need for you to be there, I'm going to tell you that. I'm not going to encourage you to keep coming in if there's really no need for you to come in. I'm not pushing to make a problem out of something. But I do think that it's a lot easier to head something off before it gets to the point of crisis. So I encourage you to look into it and consider it something to do just as a self-care routine.
Absolutely. Thank you so much, Dr. Cohen. And remember, to all of our CCMS physician members, you get 6 free sessions per year. And if you're a physician, but you're not a member of our medical society, you can join at any time so that you can take advantage of this program. For more information, visit ccmsonline.org.